Welcome to 2023. Now that we truly enter 2023, we can now plan what we want for this year. Yep, you heard me right. Start planning. Why not plan the year before it started? Well, December is one of the busiest months of the year, and most people don't have time to plan. Maybe in previous months, but if we are honest, we are too busy trying to finish the year the best we can. So there's nothing wrong about planning now. After all festivities, yummy goodies, and delicious food we ate, it is time to start eating healthy again. You can actually start your new resolutions anytime you are ready to start. It doesn't have to be New Year's. Do you know that 8% of people who make resolutions actually follow until the end? One of the main factors in being successful at this is to change our behavior about it. It is now clear that the main one cause of chronic disease epidemic is not genetics but behavior. People making wrong choices about diet, physical activity, and other lifestyle factors. In fact, in a recent study found that 85% risk of chronic diseases are due for environmental factors. Some of these we have control over them and some others we don't. Chronic disease is the biggest threat. Changing behavior is the most important step we can take to prevent and reverse chronic disease. Of course, there are a few exceptions, but prevention through changing behavior is key. It is tempting to think that we can solve this problem simply by better educating ourselves about the changes we need to make, but it is now established that knowledge is not enough to support lasting behavior changes. Most people know that eating poorly, not exercising, not getting enough sleep, and engaging in other unhealthy lifestyle habits is not good for them. Yet they continue with this behavior anyway, or they chase quick fixes that don't last for more than a few weeks. What about doctors? Shouldn't they be the ones to lead you make these changes? We simply don't have enough of them to address those and many other problems. The most recent study suggests that we will have a shortage of 52,000 primary care physicians by the year 2025. But even if we didn't have a shortage of doctors, most of them don't have the training or time necessary to support people to make long lasting behavioral changes. The same is true for most healthcare professionals. Our health system is not set up to deliver this type of care. The average visit with the primary care provider is 10 to 12 minutes, with newer doctors spending as little as 8 minutes per visit. This is barely enough time to say hello, review patient current medication, and possibly prescribing a new one with any time to assess the root cause and what behavioral and lifestyle changes would be the most effective for the patient and to provide the necessary support for sustaining them for a lifetime. So if more information or more doctors won't solve the problem, what will? People want to feel good, avoid chronic disease, and live a long life. They want to see their children and grandchildren grow up and to have the energy to play with them. They want to perform better at work, to enjoy their relationships, and be well enough to get the most out of life. There is a big difference between wanting the benefits of being healthy and consistently engaging in behaviors that lead to health. That is where health coaches and certified nutritionists come in. They are training in a number of disciplines that support people in making lasting changes. Certified nutritionists and health coaches are also trained to work with patients in a more collaborative way rather than with the expert approach that is common in medicine. In the expert approach, the authority assesses the problem, delivers advice, recommends solutions, and in some cases teaches new skills. In the collaborative way, the approach from health coaches and nutritionists is more like partners or allies that encourage clients to discover their own solutions and become their own advocates, also supporting clients in developing the skills they need to embrace new behaviors. Not surprisingly, studies have consistently shown that coaching intervention improve health outcomes for several chronic diseases including heart disease, diabetes, obesity, and cancer. This is not a small effect. In fact, some research has shown applying base principles of behavior change can increase the changes or the chances of success by over 1000%. I am not arguing that health coaches will replace doctors. Doctors and other licensed clinicians will always be required to order lab tests, to analyze test results, to diagnose disease, to prescribe treatment and coordinate care. Health coaches aren't trained to do these things, just as doctors aren't trained to support behavior change. I am advocating to support an approach that utilizes the professional that is best trained and suited for each particular need. Health coaches and nutritionists to support diet, lifestyle, and behavior changes, and doctors to practice medicine. Don't let the thought or the desire to change die. Take action today, seek the support that you need to start changing your behavior, and the habits will start to become more real and easy to accomplish. Well, thank you for joining me today. I hope this short video and all this information was helpful. Remember, eat well, move well, and be well. See you next time.